behalf for Shama Prasad Mukherjee College in Ramanujan College TLC Center for this 7 days, 1 week online faculty development program. Dr. K K Aggarwal is an Indian cardiologist who is president of CMAO, president of the Heart Care Foundation of India, and past national president of Indian Medical Association. In 2010, the government of India honored him with the Padma Shri, India's fourth highest civilian award, for his contribution to the field of medicine. Sir has published many books on health, including Ayurveda, which he combines ancient Vedic medicine with modern allopathy. Sir, we welcome you in this session, sir.
Thank you. आपका म्यूट हो गया.
Yes, sir. The session.
Should I start?
Yes, sir. You can start, sir.
Thank you, Shama Prasad Mukherjee College, for inviting me to be here and to interact on how to be healthy during the COVID time. So my topic will be how to be healthy in the COVID time. So COVID time में हम किस तरीके से अपने आप को healthy रख सकें. That is what the objective is going to be. And I'm going to pertain it to adults. That means आवाज आ रही है पीछे से. So I will pertaining it to people who are 12 years of age, above 12 years of age. So let us see pre-COVID era. In pro-COVID era, we used to die of asthma, COPD, heart attack, paralysis, heart failure, blood pressure, diarrhea, jaundice, typhoid. In the post-COVID era, our death rate should reduce by more than 50%. If you see the data from all over the world, flu has disappeared from the world. अगर कोरोना होगा तो फ्लू नहीं रह सकता. The level of education all of us have got. Everybody today is talking about knowing everything in great detail. So level of education has increased. Today, we are talking about universal lifestyle and universal signals of distress. The time is gone that SPM College organizes weekly lectures. The first week, somebody will come and will say, these are the symptoms, think of diabetes. Next week, an orthopedician will come and say, if these are the symptoms, think of a bone disease. And next week, a heart doctor will come and he will talk about cardiology. And next week, a cancer doctor comes, he starts talking about cancer. And by 5th, you start cursing कि मैं डॉक्टरी में क्यों नहीं गया. अगर इतना मेरे को पढ़ना है as a non-doctor, better I would have become a doctor. So today we need to have a universal distress signal. I don't bother whether it is cancer. Why should I bother cancer है कि heart attack है? I must have a way to find out there is universal distress syndrome. And that universal distress is, number one, anything unusual. So if you feel or observe or experience, if you feel, you observe, you experience anything which is unusual, anything coming for the first time in adult life. बच्चों में तो कोई ना कोई चीज पहली बार होगी. But if you are experiencing it for the first time in adult life, which is You cannot explain it. Doctor may be able to explain it, but you cannot explain it, or it is persistent for more than 2 weeks. Talk to your doctor. Which doctor? A GP doctor who will guide you where to go and where not to go. So that's what basically it means, that if you have a symptom which is unusual, let us see. You say, मैंने अभी मेरे को उल्टी हो गई, मेरे को उल्टी हो गई. Now this can be abnormal, or this can be normal. Suppose you say मैंने केला खाया और उल्टी हो गई. You will say, हो सकता है केले में कुछ खराबी हो, शायद उल्टी आ गई हो. Let me see, अगर ठीक हो जाती है तो मैं डॉक्टर से बात कर लूंगा. So you can justify in your mind, it may be a food poisoning. But if you say मैंने तो 4 घंटे से कुछ खाया ही नहीं है. If I have not eaten anything for 4 hours, and that would mean that I know मेरा खाना 2 घंटे में पच जाता है. So if I have not eaten anything in 2 hours, that's abnormal, that's unexplainable. I must talk to the doctor. If you say my age is 30, for the first time in my life, I have a burning in my chest. For the first time in my life, I have a burning in my chest. That's abnormal. Let me talk to a doctor. I know as a doctor, it's a heart attack. But you don't have to know whether it is a heart attack. You say, hey doc, I am having for the first time acidity attack, and this is my age. For the first time in life, if you get asthma after the age of 30, is abnormal. For the first time you are getting fever, which is very high, it's abnormal. If your fever is low grade, persisting for more than 2 weeks, show to your doctor. If the cough is persisting for more than 2 weeks, show to your doctor. So what we have learned is that if you experience, observe. There was a size in there was a gland here, there was a type of a swelling here which has suddenly increased. That's observation. Experience. Face a situation unusual for the first time, which cannot be explained, lasting for more than 2 weeks. Don't ignore it. Go back to your doctor. That's one thing which everybody should know. The second thing which I want to simplify is that your lifestyle has to be universal. You can't say, I will do this to prevent diabetes, this to prevent heart attack, this to prevent cancer, this to prevent anything. The lifestyle has to be universal. Universal means I must learn in half an hour or 20 minutes everything which will teach me how to remain healthy. And these have to be in such a way that as a non-medical person, I can remember, note down, teach, follow. Let's say the first principle is hygiene. The first principle is hygiene. So hygiene is my body, my air, my water, my food which I eat, and my excreta which I take them out. So these are called as hygiene. Let's talk about food and water hygiene. There is only one principle of food and water hygiene, and that principle is heat it, boil it, cook it, peel it, or forget it. peel it, that means आपके पास केला है और संतरा है, केले को अगर आपने छील के खा लिया तो कभी इन्फेक्शन नहीं हो सकता, बिकॉज सारा इन्फेक्शन छिलके में चला गया। सेब को अगर आपने खाना है तो अच्छे से धोना पड़ेगा। हीट इट, किसी भी चीज को गर्म कर लेंगे तो उसमें वायरसेस, बैक्टीरिया सारे मर गए। कोविड-19 भी आ गया, बर्ड फ्लू भी आ गया। बॉयल इट, किसी भी चीज को अगर आप बॉयल कर देंगे तो उसके अंदर में सारे कीटाणु मर गए। कुक इट, अगर आप किसी को अच्छे से पका लेते हो, अंडा हो, सब्जी हो, नॉनवेज हो, किसी भी चीज को अच्छे से पका लेते हो तो बीमारी नहीं फैल सकता। सो हीट इट, पील इट, कुक इट, बॉयल इट और फॉरगेट इट, नहीं तो मत खाओ। घर में अगर आप खा रहे हो, then you have to be very clear about cleaning those things. So the fundamental principle of food and water outside home, where you are not sure about the purity of the food and water, heat it, boil it, cook it, peel it, and forget it. That's the basic principle you have to follow. Then comes is respiratory hygiene, which all of us have learned during COVID-19. This respiratory hygiene basically will take care of all respiratory disorders, flu, corona, adenovirus, respiratory syncytial virus, all pneumonias, streptococcal sore throat, ये सबको ठीक करेगा। Respiratory hygiene means physical social distancing and cough etiquettes. सोशल डिस्टेंसिंग मतलब जो खांस रहा है, चिल्ला रहा है, गा रहा है, उससे 3 फुट दूर रहो। एंड रेस्पिरेटरी एटिकेट मींस अगर आपको खांसी आई तो आपने अपनी बाजू में खांसी करनी है, अपने हाथों में या रुमाल में खांसी नहीं करनी। That's all. Respiratory hygiene is over. And with that, we have to come back to the concept of अगर आप किसी के 3 फीट के दायरे में आते हैं तो आपको मास्क पहनना है। मास्क का मतलब है आउटर रिपेलेंट, इनर एब्जॉर्बेंट और बीच में फिल्टर। That's what the mask you have to use. Outer repellent जो पानी को रिपेल करे, अंदर वाला जो एब्जॉर्ब करे और बीच में वाला जो फिल्टर करे। That's mask you have to use. Then we come back to body hygiene. Body hygiene का मतलब है आंखों को साफ करना। If you are washing your eyes every day, you will not develop any type of a respiratory communicable disease. त्रिफला के पानी से, रोज वाटर के पानी से, ठंडे पानी से, गुनगुने पानी से, अपने हाथ में पानी रख के, अपनी आंख को उसमें भिगो के, if you blink, the eyes will get cleaned. आईज के बाद में नाक आई, you have to wash your nose every day. अगर आप, if you are washing your nose every day, you would have ended up not getting corona so much. Nasal hygiene means keeping the nose moist. तेल से रखो, घी से रखो, nasal saline से रखो, जलनेती से करो. Whatever you do, keep your nose moist. Then says your mouth. Mouth के अंदर में पुराने जमाने में there used to be a finger test, and we used to say 2 उंगलियों से, 1 उंगली से दांत, 2 उंगलियों से मसूड़े, 3 उंगलियों से जीभा और अंगूठे से ऊपर का तलवा. That's what we used to say. Therefore, what has happened today is we are only cleaning our teeth. We have stopped cleaning our masude, our tongue, and our talwa upar. And that's the reason कोरोना जैसे इन्फेक्शंस आ रहे हैं, because वहां पे डट पड़ी हुई है, वहां आके वो चिपक जाते हैं. So mouth hygiene means cleaning your teeth, front and back, upper and lower, your gums, your palate upper, and your tongue in the front and tongue in the back. That's what means. And then comes is washing your body. Washing your body में हमारे यहाँ पे पूरे हमारे यहाँ पे शास्त्रों में 5 चीजें बताई गई थी that cleaning your body में, and that was पंचामृत. आप घर में पंचामृत पूजा में बनाते हैं. पंचामृत से भगवान को नहलाते हैं. अहम ब्रह्मस्मि, वही भगवान मेरे अंदर है, और वही पंचामृत का प्रिंसिपल आप अपने ऊपर में क्यों नहीं अप्लाई करते? दूध से सूदनिंग होती है. दही टेक्स अवे द डर्ट. दही वर्क्स लाइक ए साबुन. Oil works like a moisturizer. Oil works like a ghee, or it works like a moisturizer. Shahad works like a moisturizer, and oil is more of a lubrication, and shahad works like a moisturizer, and khand works like a friction to remove the dead skin. So जिस प्रकार से हमारे यहाँ पंचामृत का मेंशन है, उस तरीके से अगर हम अपनी बॉडी को साफ करेंगे तो स्किन की बीमारियां कभी नहीं होंगी. बट वी एंड अप इनटू ए डिसीज बिकॉज वी डोंट नो हाउ टू वॉश. देन कम्स इज अपने पैर को हम धोते नहीं हैं. जैसे हाथ को धोते हैं, हाथ को धोने का तरीका है सुमन के. एस फॉर सीधा, ऊ फॉर उल्टा, एम फॉर मुट्ठी, A for अंगूठा, N for नाखून, and K for कलाई. That is called सुमन के, SUMANK. उसी तरीके से हमें पैरों को भी धोना है. सीधा उल्टा ऐसे करके जो है हम धोते नहीं हैं. Now you go back to our literature and our culture. There is a mention of छठोपचार पूजा, कि हम भगवान की पूजा कैसे करते हैं. फिर उसका मेंशन आता है अतिथि की पूजा कैसे करते हैं. सो वी कम बैक टू द कॉन्सेप्ट इज अतिथि देवो भव. सो अतिथि कहाँ है? जो घर में आ रहा है, या मेरे अंदर की बॉडी में मेरा जो अतिथि है, मेरे घर में जो अतिथि है. अतिथि के सबसे पहले पैर धुलवाए जाते हैं. अगर हम अतिथियों के पैर धुलाते और ये परंपरा होती तो कोरोना इतना तंग नहीं करता. फिर हम उसके हाथ धुलवाते हैं. अगर हम सबकी ये प्रथा हमारी चल रही होती तो हमारे को दोबारा से सीखना नहीं पड़ता. फिर हम उसको बोलते हैं हाथ मुंह धो ले. फिर हम उसको बोलते हैं कि तूने हाथ धो लिया, अब मुंह भी धो ले. कहते हैं ना, पैर के बाद में हाथ मुंह धो के. हाथ मुंह धोने का मतलब है उसको कुल्ला कराते हैं. आजकल हम उसके मुंह के अंदर में उसको पोविडॉन आयोडीन का गुल्ला कराते हैं ताकि अगर कोई वायरस है तो मर जाए. सो वी डू ए गार्गल विद एनी, चाहे वो नीम का पानी हो, हमने एक बार लिस्टरीन हो. जब हमने उसको हाथ मुंह धुला दिया, उसके बाद में हम उसे मिष्ठान खिलाते हैं. मिष्ठान किस चीज की? गुड़ का. और अगर वो गुड़ खाने के बाद में बोल रहा है कि मुझे इसका टेस्ट नहीं आ रहा, तो कोरोना है. कोरोना में टेस्ट चला जाता है. ऐसे आदमी को जब हम मिष्ठान खिलाते हैं, अगर वो बोलता है कि मुझे टेस्ट नहीं आ रहा, तो हम प्रणाम बोलते हैं, घर जाओ, मेरे घर में आप नहीं आ सकते. दैट इज कॉल्ड टेस्टिंग फॉर मीठा. फिर हम उसके ऊपर में इत्र छोड़ते हैं. देखिए पुरानी परंपरा है इत्र छोड़ने की. वो कहता है क्या स्मेल है, आ जाओ. वो कहता है क्या बदबू है, जाओ, कोरोना है तुम्हारे को. स्मेल एंड टेस्ट चला गया उसका. तो हमारी परंपराओं में तो लिखा हुआ था कि मिष्ठान और उसको सुगंध घर में घुसने से पहले सूंघवानी है, क्योंकि पता था उन लोगों को इस प्रकार की बीमारियां होती है या होने वाली हैं. फिर हम उसको क्या कहते हैं? प्रणाम. हम उसको प्रणाम करते हैं, और प्रणाम करते हुए सर नीचे कर लेते हैं. क्योंकि जैसे ही मैंने सर नीचे किया, वो बोलेगा आशीर्वाद, उसका वायरस मेरे ऊपर से निकल गया अगर है तो। अगर मैं उसको ऐसे बोलूंगा प्रणाम, आंखों आंखों में मिला के, तो हमारी दोनों की हवा आपस में एक्सचेंज होगी। तो ये अब सवाल लोगों, हमेशा लोग पूछते थे कि प्रणाम करते हुए नीचे क्यों झुकते हैं? अरे भाई, उसका वायरस ऊपर से निकल जाए। और उसके बाद में हम ऊंचे आसन पे बिठाते हैं। ऊंचे आसन पे बिठाने का मतलब है आंखों से आंखें नहीं मिलाते। कहते हैं बड़ों से आंखों से आंखें नहीं मिलाना, क्योंकि वायरस आपके एक के मुंह से दूसरे के मुंह में जा सकता है। तो टोटल अतिथि देवो भव हमारे को सिखा रहा है बीमारियों से कैसे बचें, कोरोना से भी बचा रहा है। इसी से टीबी से भी बचाव होगा, बाकी सारी बीमारियों से भी बचाव होगा। नाउ वी कम बैक। सो वन इज हाइजीन, सेकेंड इज लाइफस्टाइल। दूसरा आता है लाइफस्टाइल, कि मेरा लाइफस्टाइल कैसा हो। तो उसमें सबसे पहला लाइफस्टाइल में आता है, ऐसा कौन सा लाइफस्टाइल है जो मेरी बॉडी में सारी बीमारियों की जड़ है। अस्थमा, निमोनिया, ब्लड प्रेशर, डायबिटीज, ओबेसिटी, कैंसर, इन सब की बीमारियों की जड़ क्या है। अगर आप दोनों मैडम्स आपके कमरे में अगर अभी 4 लोग घुस जाएं बिना बताए, तो आप क्या करोगे? अगर आपके घर में, मैं आपसे सवाल पूछ रहा हूं, अगर आप इस ऑफिस में बैठे हो, 2 लोग बैठे हैं और अभी 4 लोग यहां घुस जाएंगे, तो आप क्या करोगे? जिनको आप जानते नहीं हो, तो क्या करोगे? बताइए आप।
सर, पुलिस को कॉल करेंगे या फिर भागने की कोशिश करेंगे, 2 ऑप्शन।
या तो उनको भगाने की कोशिश करेंगे, या खुद भागने की कोशिश करेंगे, या पुलिस को बनाने की कोशिश करेंगे।
Yes.
तो उसी प्रकार से मेरे शरीर में ट्रिलियंस ऑफ सेल्स हैं। अगर उस सेल में कोई नॉन सेल्फ घुसने की कोशिश करे, अगर मेरी सेल के अंदर, इस वक्त में आप एक सेल में बैठे हो, ऐसे 6 ट्रिलियन सेल्स मेरी बॉडी में हैं। एक सेल के अंदर में अगर कोई घुसने की कोशिश करे, इसे हम बोलते हैं नॉन सेल्फ, जिसको आप जानते नहीं हो। अब वो क्या क्या हो सकता है? मलेरिया का पैरासाइट भी हो सकता है, कोविड का वायरस भी हो सकता है, कोविड के वायरस के अलावा टीबी का बैक्टीरिया भी हो सकता है, पोल्यूशन का पार्टिकल भी हो सकता है, एबनॉर्मल खाना भी हो सकता है, जहर भी हो सकता है। तो कोई भी चीज जिसको मैं नहीं पहचानता, केमिकल भी हो सकता है, पॉइजन भी हो सकता है, पेस्टिसाइड भी हो सकता है, इंसेक्टिसाइड भी हो सकता है। तो कोई भी चीज अगर मेरी सेल में घुसेगी, तो मेरी सेल उस पर रिएक्ट करेगी। अगर कोई भी चीज मेरी सेल के अंदर घुसती है, तो मेरी सेल उसको रिएक्ट करेगी। उस रिएक्शन को हम इन्फ्लेमेशन बोलते हैं। रिमेंबर द वर्ड इन्फ्लेमेशन मीन्स reaction of the self with the non-self. So reaction of the self with the non-self is called as a inflammation. It is also called as a cell injury. It is also called as a cell injury. This cell will cause inflammation. Inflammation will present as silent inflammation or overt inflammation. Overt inflammation can be local or systemic. Local का मतलब है मेरे को बिच्छू ने काट खाया, तो वो यहाँ पे इन्फ्लेमेशन हो जाएगा। दिस इज कॉल्ड लोकल इन्फ्लेमेशन। अगर वो इन्फ्लेमेशन बिच्छू का जहर पूरे शहर में चला गया, मेरे पूरे ब्लड में चला गया, तो हर सेल के अंदर में इन्फ्लेमेशन हो जाएगा। सो इट कैन बी लोकल और सिस्टमिक। ये वाला जो इन्फ्लेमेशन है आपको दिखाई देता है, बुखार आ गया आपको दिखाई देता है। मैं बातचीत कर रहा हूं उस इन्फ्लेमेशन की जो साइलेंट है और आपको दिखाई नहीं दे रहा। सो वो इन्फ्लेमेशन जो साइलेंट है और आपको दिखाई नहीं दे रहा। ना इमेजिन अंगीठी, कि आपके पास एक अंगीठी है, अंगीठी के अंदर में आग लगी हुई है, आपने कोयले को गर्म किया और उसमें हल्की सी आग लगा दी, लेकिन बाहर से वो आग दिख नहीं रही। उसको दिखने के लिए आप फूंक मारते हो, जैसे ही फूंक मारते हो आग जल जाती है। वो स्टेज अंगीठी की जो दिखने में गर्म है लेकिन दिखने में आग नहीं लगी हुई, और उसको आग को लगने में फूंक की जरूरत है, उसे हम साइलेंट स्टेट बोलते हैं, साइलेंट फायर। जैसे ही इसमें फूंक मारोगे आग जल जाएगी। उसी प्रकार से अगर मेरी बॉडी में साइलेंट इन्फ्लेमेशन है, तो कोई भी वायरस, बैक्टीरिया, पॉइजन, इंसेक्टिसाइड, पोल्यूशन उसमें फूंक मारेगा तो आग लग जाएगी। इसे हम बोलते हैं प्रेसिपिटेटिंग फैक्टर। लोग कहते हैं कि मेरे को कभी कभी अस्थमा का अटैक पड़ जाता है। इसका मतलब क्या है? अस्थमा का जिसने मुझे अस्थमा प्रेसिपिटेट करना है, उसने आके फूंक मारी और मेरा अस्थमा प्रेसिपिटेट हो गया। किसी ने बोला कि मेरे को वायरल होता है तो निमोनिया हो जाता है। वायरस ने आया, फूंक मारी, आग लग गई। कोरोना भी यही काम करता है। और अगर वो आग ज्यादा हो जाए उसे हम साइटोकाइन स्टॉर्म बोलते हैं। फेफड़ों में करेगा तो निमोनिया कर देगा, लिवर में करेगा तो लिवर में डैमेज कर देगा। सो आज की डेट में अगर मेरे को मल्टीपल बीमारियों से बचना है तो मेरे को अपने शरीर में इन्फ्लेमेशन नहीं चाहिए। अब इन्फ्लेमेशन मुझे कैसे पता लगे कि मेरे शरीर में इन्फ्लेमेशन है कि नहीं है? अगर आपको बार बार बुखार आता है, आपको बार बार मुहासे आते हैं, एक्ने आता है, अगर आपको बार बार अस्थमा का अटैक पड़ता है, बार बार बॉयल्स आते हैं, या फिर आपका वजन बढ़ रहा है, इन सब के अंदर में इन्फ्लेमेशन दिखाई देगा। So I will show you two types of inflammation. One, I will show you inflammation which is evident but still silent. So let me show you still silent. तो मैं आपको एक चीज दिखा रहा हूं। अब एक भाई साहब हमारे साथ आए, उनकी स्किन के ऊपर में कालापन था, उनकी आंखों के नीचे कालापन था। ये एक भाई साहब थे जो हमारे पास में आए, स्किन में कालापन था, चेहरे में कालापन था। हमने उनसे पूछा कोई तकलीफ? बोले कोई तकलीफ नहीं है। इसे हम बोलते हैं बॉडी में इन्फ्लेमेशन है। ये करीबन 20 से 25% पॉपुलेशन में निकलेगा। इन्फ्लेमेशन के अंदर में शरीर काला होना चालू हो जाता है, आप कहते हो उम्र का तकाजा है। आंखों के नीचे कालापन आ जाएगा, यानी कि आग दिख भी नहीं रही है, बुझी हुई भी नहीं है, हल्की सी आग है। हल्की सी आग है मेरे शरीर में, तो आग, स्किन मेरी जल रही है लेकिन मेरे को महसूस नहीं हो रहा। फिर हमने इन भाई साहब का बैक देखा, तो बैक के अंदर में कालापन था, बैक में स्किन टैग्स थे। फिर हमने इनकी कोहनी देखी, कोहनी में कालापन था। फिर हमने इनकी आर्मपिट देखी, आर्मपिट में कालापन था, आर्मपिट में कालापन था। बैक में हल्के हल्के निशान आ रहे थे, कोहनी में कालापन था। पैंट उतरवाई, शर्ट उतरवाई तो पेट का मोटापा था। इनके हिसाब से मैं बिल्कुल फिट हूं। इनके हिसाब से मैं बिल्कुल फिट हूं। बोले तुम तो खानदानी है, सबकी निकलती है, मेरी भी निकल गई, क्योंकि इनके हिसाब से इनको ब्लड प्रेशर नहीं है, डायबिटीज नहीं है, कोलेस्ट्रॉल नहीं है, हार्ट अटैक नहीं है, तो इसका मतलब है कि मैं स्वस्थ हूं। सो दिस इज द एक्सट्रीम डिग्री ऑफ मेटाबॉलिक सिंड्रोम। दिस इज एक्सट्रीम डिग्री ऑफ इन्फ्लेमेशन इन माय बॉडी। मेटाबॉलिक सिंड्रोम मीन्स मेरी बॉडी के अंदर में, सिमिलरली यू कैन सी वन मोर पेशेंट, सेम काले रंग का कलर इनका, यहाँ पे पेट का मोटापा एंड स्लाइट बैकनेस, थोड़ा सा पहले वाले से कम। बाकी लोगों का क्या होगा? इन्फ्लेमेशन होगा तो उनका, जैसे फॉर एग्जांपल, मैं लेट मी टेक एन एग्जांपल, कि अगर एक लड़की का वजन 18 साल की उम्र में, उसके बाद में 28 साल की उम्र के तक उसका वजन 60 किलो हो जाता है, दिखने में खट्टी खट्टी दिखेगी कि मैं बिल्कुल ठीक हूं, लेकिन याद रखिए जब तक आपकी हाइट बढ़ रही है वजन बढ़ेगा। जिस दिन आपकी हाइट बढ़नी बंद हो गई, अगर वजन बढ़ रहा है तो वो मोटापा है। अगर जिस दिन आपकी हाइट बढ़नी चालू हो गई, उसके बाद में एनीथिंग मोर देन 5 kg इज मोटापा। अब मोटापे में क्या होगा? लेट अस सी। मोटापे के अंदर में अगर मेरा वजन बढ़ रहा है, इसका मतलब क्या है कि मैंने एक्स्ट्रा कैलोरीज ली, बॉडी को नहीं चाहिए। तो मेरे यहाँ पे 2 प्रकार के सेल्स होते हैं, व्हाइट सेल एंड ब्राउन सेल। व्हाइट सेल, ब्राउन सेल को आपने खाना दिया, उसने यूज कर लिया एक्सरसाइज के अंदर में, अगर वो बच गया तो उसने व्हाइट सेल में दे दिया। व्हाइट सेल के अंदर में घुसा तो रिएक्शन होगा। जैसे आपने कहा आपके कमरे में 2 लोग आएंगे तो हम रिएक्ट करेंगे, उसी तरीके से मेरी सेल में, व्हाइट सेल के अंदर में अगर कोई भी फैटी एसिड घुसेगा तो इन्फ्लेमेशन होगा। सो द इन्फ्लेमेशन का मार्कर इज सी रिएक्टिव प्रोटीन। पॉजिटिव नेगेटिव 8 रुपए का टेस्ट है, क्वांटिटेटिव 150 रुपए का टेस्ट है। तो कभी भी आपको लगे कि मेरे को खाना खाने के बाद में स्फूर्ति आने के बदले सुस्ती आती है, मेरे को खाना खाने के बाद में स्फूर्ति आने के बदले सुस्ती आती है, दोपहर में खाना खाने के बाद मुझे नींद आती है कंपल्सरी, मैं थोड़ा सा चलता हूं मुझे थकान आ जाती है, दैट मीन्स यू हैव लो ग्रेड इन्फ्लेमेशन इन द बॉडी। मेरे को बार बार लगता है टेम्परेचर है लेकिन नापने में नहीं आता, I feel discomfort, I feel tired all the time. These are all signs of inflammation in the body. Your blood test may be normal. Or if your blood test shows CRP more than 1. अगर आपका सी रिएक्टिव प्रोटीन 1 से ज्यादा है, इसका मतलब है बॉडी में कहीं तो भी इन्फ्लेमेशन है। जब सीआरपी ज्यादा होता है तो 2 प्रकार का सीआरपी है, जो अलग अलग ऑर्गन्स के कारण से सीआरपी बढ़ सकता है। आंखों में, स्किन में, छोटी आंत के अंदर में यानी कि जीआई ट्रैक्ट के अंदर में, लिवर में या हार्ट में। ये 5 एरियाज हैं जहां पे अगर कहीं पर भी इन्फ्लेमेशन हो तो सीआरपी बढ़ सकता है। तो इस तरीके से आप पता लगा सकते हो कि मेरा सीआरपी कहां बढ़ रहा है। उसके अलावा अगर आपका सीआरपी बढ़ा है बिकॉज ऑफ फैटी एसिड ज्यादा खाने से, तो ये मसल में जाएगा। मसल में अगर सीआरपी बढ़ गया यानी कि इन्फ्लेमेशन आ गया, तो फिर आप क्या कहेंगे कि मेरे को मस्कुलर वीकनेस है। जमीन पे बैठ के हाथ को ऊपर करके आप खड़े नहीं हो सकते, यानी कि आपको मसल वीकनेस है। और जैसे ही वीकनेस होगी आपके घुटनों में दर्द चालू हो जाएगा। अगर लिवर में चला गया तो आपको फैटी लिवर हो गया। आंखों में चला गया तो आपको आंखें बार बार तकलीफ होगी। स्किन में चला गया तो आप बोलोगे मेरे को जगह जगह रैश आते हैं। पेट में चला गया तो पेट का मोटापा आ गया। लड़कियों के ब्लड में चला गया तो यहां बाल आ गए, और वो जा की ब्यूटिशियन की यहां जा के बाल निकलवा रही हैं अपने। उनको मेंस्ट्रुअल एबनॉर्मेलिटीज हो गई। अगर उनकी ओवरी में चला गया तो पॉलीसिस्टिक ओवेरियन डिसीज हो गई। अगर हार्ट में चला गया तो हार्ट अटैक हो गया। ब्रेन में चला गया तो ब्रेन अटैक हो गया। अब देखिए, सेल में चला गया तो कैंसर हो गया। अब देखिए ना, अब आप जा रहे हैं, अब कैंसर वाला जाएगा ये करो, हार्ट वाला बोलेगा ये करो, किडनी वाला बोलेगा ये करो, वो वाला बोलेगा ये करो। जड़ तो सीआरपी है ना, जड़ तो इन्फ्लेमेशन है ना। एक जड़ है, वो है मेरी बॉडी में सेल्फ वर्सेस नॉन सेल्फ की रिएक्शन, जिससे इन्फ्लेमेशन हो रहा है। अगर मैं उस इन्फ्लेमेशन को रोक दूं तो ये सारी बीमारियां मेरी रिवर्स हो जाएंगी। तो अक्सर लोग क्या कहते हैं, मैं 18 गोलियां रोज की खा रहा हूं। बोले क्या है, 2 डायबिटीज की, 1 थायराइड की, 3 ब्लड प्रेशर की, 4 हार्ट की, 2 लिवर की। और अगर उन सबको रोकने के बदले अगर मैं जड़ को ठीक कर दूं, अगर मैं जड़ को ठीक कर दूं, तो मेरा इन्फ्लेमेशन अगर खत्म हो गया तो मैं सारी बीमारी को ठीक कर सकता हूं, उसको रिवर्स कर सकता हूं। So what I can do is, so my basic objective is to take care of my body in such a way that I reduce inflammation in my body. How do I reduce inflammation in my body? That is now the principle we need to understand. These are the principles we need to understand. Now let us say, if I come to your college and you invite me for a lunch, will you say we will have only salt in the lunch? And you serve me only a katori of salt and you say this is the lunch? The answer is no. Or you will say I will only serve you kali mirach in the lunch, or red pepper or a black pepper? No. Will you say I will serve you only achar in the lunch? No. So pungent, sour and salt. Pungent, any food item which is pungent, which is sour, which is salty, pungent, sour and salt will increase digestion, but in excess will cause inflammation. So if I take a lot of salt in excess, it will cause inflammation. If I take red pepper, black pepper, green pepper, chilies, green chilies, red chilies, black pepper, this will in excess will produce inflammation. And if I take lot of sour fruit, fermented food, lot of fermented food, including excess of alcohol, will cause inflammation in my body. So reduce inflammation, I need sweet, bitter, and astringent. Now, sweet means millets, sweet means grains. These are all sweet, naturally sweet. But artificial sweets are harmful. Artificial sweet means I have refined them. So from wheat, I have made the maida, and that will become a refined carbohydrate that will be harmful. So first generation non-refined carbohydrate or bitter or astringent, kasela. Astringents are pulses. Apple is astringent. Banana taste is astringent. Katha, which you use in a pan, is astringent. Now, if you see in this corona, everybody is drinking kada. What is this kada? Nothing but bitter and astringent. Because in your life, you were not using bitter and astringent. You were drinking a lot of kada. Therefore, non-inflammatory diet is all 7 colors and 6 tastes. So if you balance all 6 tastes in your body, that means sweet, bitter, and astringent in equal quantity, pungent, sour, and salt in limited quantity, and all 7 colors, means every color is a vitamin, and third, fresh, seasonal, locally grown, and wherever possible, sprouted. When you sprout a plant, you increase its minerals and trace elements. So whenever you include sprouting, you get zinc, you get all types of materials with that. So therefore, non-inflammatory diet means balancing all 7 colors and 6 tastes in the diet. That's the first principle of non-inflammatory lifestyle. Now here I will make you remember now a formula, because otherwise you will not be able to remember it. And the formula is, if you want to live 80 years of your life without any inflammatory lifestyle disorder, remember this formula of 80. The formula of 80 is, keep your pulse rate lower than 80. That means if you have all the time high pulse rate, means you are living a stressful life. Keep your lower cholesterol less than 80. LDL, lower cholesterol less than 80. Keep your fasting sugar less than 80. Keep your lower blood pressure less than 80. Keep your abdominal circumference less than 80. So what you do is, your lower blood pressure, your pulse rate, your fasting sugar, your abdominal circumference, your bad cholesterol levels, all bring them less than 80. Along with that, you keep your lung functions and kidney functions above 80%. That has to be decided by your doctor. Now, how do I do that? How do I do that? To do that, walk 80 minutes a day, brisk walk 80 minutes a week. When you walk minimum 80 steps in a minute, when you do cardio 80% of your required heart rate, which is 220 minus age. So by this, you remember the formula of 80. That means I have to walk and I also have to brisk walk. So normally we say 2 days in a week walk, 2 days in a week brisk walk, and 2 days in a week do resistance training. That's what the formula of 80 is. When it comes to eating, eat less, not more than 80 gram of caloric food at one time, or not more than 80 ml of caloric liquid at one time. And 80 days in a year, you do a wheat fast. Do not eat wheat 80 days in a year. Now let's give a calculation. Calculation is, suppose you say my weight is 80 kg. To maintain that 80 kg, multiplied it by 30, you require 2,400 calories per day. So if you take 30 calories per kilogram, you will maintain a weight of 80 kg. Now, suppose you say, I want to become 70 kg, then you require 70 into 30, 2,100 calories every day. That means you need to reduce 300 calories every day, which means you can burn out 150 calories and reduce only 150 calories one day. Now let us calculate how much do you eat. 1 gram of carbohydrate gives you 4 calories. 1 gram of protein gives you 4 calories. 1 gram of fat gives you 9 calories. So if I have a mix of all three, it becomes 17 calories for 3 grams. 1 gram of protein, 1 gram of fat, 1 gram of carbohydrate. Average comes out to be around 6 calories per gram. Therefore, if you say, I want to maintain my weight at 21, that means 70 kg, and you need 2,100 calories, then you need only 350 grams of food per day. We only want to eat 350 grams of food one day, which will mean 80 grams of food 4 times in a day, or 120 grams of food 3 times in a day. Now recall, when you go to a party, so you first take chaat party, then you say, let me have snacks and let me have soft drink. So first dinner is your chaat party. The second dinner is snacks and soft drink. Then you have the third dinner, you say the main supper. And then you say, let me have a sweet dish. On an average, you eat minimum 200 grams in a party and maximum 750 grams in a party. Imagine when you are going to a party, you need 350 grams in the whole day. And you are consuming 350 grams of sweet after eating full food. Now, this causes distress in my white cells, and this causes number one cause of obesity. This causes number one cause of obesity. So therefore, if I am eat less, not more than 80 grams of food in one go, not more than 80 ml of liquid in one go. Next thing which comes is keep air pollution less than 80, keep noise pollution less than 80. So air pollution and noise pollution should be kept less than 80. Do 20 cycles of parasympathetic breathing called pranayam every day, so that you can give time to yourself. 80 days in a year, sit in sunlight with a formula of 40. And the formula of 40 is that 40 minutes a day, you need to expose your 40% of your body to sunlight. That's the formula. So 80 days in a year, sit on sunlight. Do not take alcohol. If you take and there is no contraindication, not more than 80 ml or 80 grams in a week. Do not smoke. If you take 80,000 will be the expenses required for any heart problem. If you do that, there are 80% chances by the age of 80, you will not develop any. If you develop it, then ask your doctor for 80 milligram of aspirin, of statin. You will not get a heart attack. If you get a heart attack, ask your doctor, is the blockage less than 80 or more than 80? If it is more than 80 and symptomatic, you need an intervention. Less than 80, go for medical treatment. You will not die. Even if you die, somebody will come back and teach you and save you using the formula of 10. And that is within 10 minutes of death, earlier the better, at least for the next 10 minutes, earlier the better. 10 into 10, at least with a speed of 100 per minute. Compress the center of the chest of a dead person effectively and continuously. And if you do that, a dead person may get revived. Now, this is a generalized universal formula. And the main universal formula, how do I know, is C-reactive protein less than 1, CRP less than 1. If your CRP is less than 1, vaccine cannot cause any reaction in you. If your CRP is less than 1, corona will not cause any reaction in you. All those patients who have died because of corona, they all had underlying inflammation. Corona came, it inflamed, increased the inflammation, ending up into systemic organ failure. So as on today, all of us, if we start living a non-inflammatory lifestyle, we will be able to live longer, happily, and healthy. Now, this is as far as the physical part. I will speak for another 10 minutes, and then we will have question answers. The another part is, what about the mental stress? What about the fear? What about anger, hostility, depression? So what is stress? Stress is the reaction of the body and the mind to the interpretation of a situation. So if there is a stress, either you change the situation. अब कोरोना की सिचुएशन तो चेंज नहीं कर सकते, लॉकडाउन हो गया तो हो गया. You can't change the situation in corona. If lockdown has happened. But you can change your interpretation. That means counseling, cognitive behavior therapy, discuss, find out solutions and not the problems. And third is keep your CRP less than 1. That is, change your lifestyle in such a way that nothing affects you. So for a mental health problem, if there is a stress, to manage that stress, keep your CRP less than 1, change the situation if you cannot change your interpretation. Now, how do I change my interpretation? There is a simple formula called Monday to Saturday formula. Because this video is going live, lots of things I have taught. You can re-watch them again and again. On Monday, try to live a life of non-violent communication. That means on Monday, you are not going to complain, you are not going to condemn, you are not going to criticize anybody. On Monday, you say, if somebody abuses you, you say, I'll see you tomorrow. Today is my Monday fast. I cannot abuse you today. So on Monday, non-violent communication. You only communicate facts. No gossip on Monday. Today is a no gossip day. By that time, on Monday, you will purify your mind because you are not talking anything other than a fact. On Tuesday is a forget and forgiveness day. You talk to 25 people you have not talked to in the last 6 months. And on every Tuesday, you talk to somebody जिससे आपकी नहीं बनती. Who is your enemy, who is your not a well-wisher, talk to him. Because that will clarify you. From my side, I am okay. If you don't like me, that's your concern, not mine. Make an effort on Tuesday to talk to those people who don't like you or you don't like them. Wednesday, distribute gifts every day. Every Wednesday, distribute non-materialistic gift. Anybody who made, you say, very good. Very good. How are you? You're looking very, very handsome. You are looking very gorgeous. Obviously, you know whom to speak and whom. Not to speak, but give them a compliment, give them a smile, give them a non-materialistic gift. On Thursday, think differently. Just think differently. Can this be like this? Can this be like this? Could I have done it like that? Just on Thursday, think differently. On Friday, enjoy the nature. Go back and see, today I want to see the butterflies. Today I want to see the birds. Today I want to hear the music of the fountain. So enjoy the nature on Friday. And on Saturday, whosoever meets you, just ask, how can I help you? That's all. On Saturday, ask everybody, how can I help you? That is called Sunday is called as a cheating day. तो थोड़ी बहुत चीटिंग अलाउड है कि मंडे को उसने मुझे गाली बकी थी, मुझे उसको गाली बकनी है आज. So take out whatever is negative in you on Sunday. So Sunday is the cheating day. So Monday to Saturday you can do. And if I have to come back to one formula at the end, that is called as a formula of Saturday. And the formula of Saturday is, may I help you? Now, how does this may I help you helps you? So there are 4 yuga, Satyug, Treta Yuga, Dwapar Yuga and Kal Yuga. Satyug means truthfulness, devotion, that is tapasya, tap, pure thoughts, that is pavitrata. Daya and dan means charity and compassion. So if you have all 4 of them, you are a Satyogi. But sometimes you speak a lie. That's you are a Treta Yogi. But if you also speak a lie and also you are sluggish in your work and you say, who cares? Then you are a Dwapar Yogi. And if you are also negative in your thought, you are a Kal Yugi. If I ask all of you sitting here, who are you? All of you will say, I am a Kal Yugi because I'm living in Kal Yug. But how can a student of SPM college be a Kal Yugi? In Satyugi, we have Devta and Danav together. In Treta Yuga, we have Ram as well as Ravan. In Dwapar Yuga, we have Krishna as well as Kans. So in this Kal Yuga, there have to be somebody. All of them may be Kal Yugi, but some will be good people. Some persons will be good people. Why can't that be the students, staff, and teachers of SPM college? So SPM college should say that we are the Satyugi of Kal Yuga. We are in minority. Majority of the people speaks a lie, but we are Satyugi. Okay, So I said, become a Satyugi. You come back to Dr. K K Aggarwal, give me a prescription. So I take a tablet. And become a Satyugi. So all of you give you a prescription, and that is may I help you? You just put it on your, you wear this, may I help you? Now what happens is, when you wear as a prescription, may I help you? If anybody asks you for a help, if anybody asks for your help, truthfulness will come. You can't make a lie because you are asking, do you need a help? If he is asking for a help, now you can't say, I will not help you. Then he says, then why you are wearing this? So truthfulness comes. Hard work comes because now you have to do it. You can't say, okay, I'm not going to do it. You have to do it. You have to do it with a pure mind. Compassion comes, charity comes. So if you want to become a Satyugi in Kali Yuga, just have the habit of asking everybody, may I help you? And therefore we say once in a week, we are not talking every day, every moment. Once in a week on Saturday, practice, may I help you? May I help you? May I help you? Now, if you can't help, say no. That's also, if you say, I will not be able to do, it's also a Satyugi no. It's not a Kalyugi no. And provided you have made and intentionally told them why I am saying no. So if you really want to become a Satyugi in Kali Yuga, you have to follow the principle of Shama Prasad Mukherjee, and that is, may I help you, may I help you, may I help you. That's what I say as a doctor. Somebody asked me, how many dharam are there? How many religions are there? And I always say there is only one religion, and that is religion of humanity. And that religion is practiced by a word called, may I help you. If I put down that as a part of my life, I will develop. So if somebody has to ask me two take-home messages from today, keep your CRP less than 1, and may I help you. To do that, practice whatever you want. And another thing which I want to say is, if you can walk 500 meters in 6 minutes, that's fitness. So you are healthy, CRP less than 1. May I help you? Am I fit? If I can walk 500 meters in 6 minutes, I am fit. Over for question answers.
Thanks a lot, sir, for such a wonderful session. We are getting so many comments in the chat box that this is the best of the one of the best session they had till now. So, sir, many of the participants you can also see in the chat box. There is a really good session. Thanks, Dr. Aggarwal. Each one is full of so much knowledge and think they gain so much. So I just request participants that they just ask the questions, and we are getting so many thankful messages. Thanks a lot, sir, for sparing so much of time instead of your busy schedule. And we really think, sir, please post your question in the chat box. In case you have any kind of question, just raise your hands. I can also unmute you all. Just put up your questions. Sir, uh, hmm, I'll take a question.
Thank you so much, sir, for sparing your time, because ma'am was saying that you are extremely busy, and we know that you are extremely busy. Once again, thank you so much, sir, for your insightful lecture. Or we will keep in mind. May I help you? Thank you. Thank you so much.
Thank you.
Thank you.
Sir, there is one now. Questions are coming, sir.
No problem. I'm here.
Please, you suggest the lifestyle for a differently able people.
So if you have a differently able people, exercise can be done whatever way you can, sitting, standing, lying. All exercises are possible. They are as good as an exercise. Build up your muscles, you can do that. Mentally, depending upon their level of mental health, those types of exercises can be done. Food habit remains the same. There is no change. Food habit remains the change.
One more question. If we do exercise daily, then we need more food.
No, that's not correct. You need enough food to exercise, not more food to exercise. The reason being that you are not going to take a kg extra to reduce. So let me give you an example. If you go from 10 kilometers walk today, suppose you take 10 kilometers walk, or you take 1 hour of walk. If you take 1 hour of brisk walk, you will burn something like 5 calories in 1 minute. Okay, that will be 300 calories. And you come back and take, suppose, hot chocolate fudge, you will be 900 calories extra. If you walk for 1 hour, brisk walk for 1 hour, come back and eat one balu shahi or one mithai, you will be 100 calories extra. Okay, exercise you do to burn what you are taking. But if you are going to take much more than that, it is going to get deposited. After eating, if you feel energetic, that's what you need. But after eating, if you say, let me sleep for half an hour, it means your body never needed that lunch. That's what I'm trying to say. Those people who says when we exercise, we need more and more of food is before your height stops growing. For children, yes. For children, yes. For adults, you must eat less than your children. Now, those people who are talking about when we exercise, they are talking about muscle building. They are talking about muscle building. Muscle building, you need more protein. And muscle building should not be more than 5 kg of your weight extra. Anything more than 5 kg is not recommended. That's what we say.
So one more question. Please guide about how to combat.
And for life, if you can, remain like a lion. Whole life, if you can remain like a lion, then don't listen to me, whatever I'm saying, do what you want. The reason being, lion runs for 20 miles a day to catch a prey and eat. So if you run 20 miles a day, then whatever I have said is not applicable. It is applicable for those. A lion in the zoo is like what I'm talking about. I'm not talking about a lion in a jungle. All of us are living in a zoo called a house. Everything is given to us. Everything is given to us in a plate. Similarly, a lion is given a food in his chamber in a zoo. He also will and get up, obeys, and he will also end up with a heart attack and die. So what I am talking about is military people eat a lot, but they exercise a lot also. Remember that if you exercise, then eating is fine. But In that eating, you must remember that none of the cricketers are given excess of refined carbohydrates. They eat a lot, but without refined carbohydrates, because that takes away their efficiency. They eat a lot because they exercise, but non-inflammatory diet.
Sir, only two more questions are there.
So please guide about how to combat metabolic disorder.
So if you want to combat a metabolic disorder, one thing is you need to burn white cells in the body. White means white fat cells in the body. And for that, exercise is a must. Walking is a must. Without walking, what will happen is that metabolics, if you only go to diet, metabolic syndrome will not progress, but will not regress. So do not progress is diet, regress it by exercise. Number two, the best exercise for metabolic syndrome is weight strengthening. If you strengthen your muscles, your metabolic syndrome will go away. So I tell all my friends and all my followers, if you want to cure yourself of osteoarthritis, obesity, heart attack, metabolic syndrome, every day in the evening, 7 o'clock to 7:30 p.m., watch Dr. K K Aggarwal live on YouTube and Facebook. If you do that, you will never get, all your diseases will get slow down. And there is a catch there. And the catch is watch Dr. K K Aggarwal on YouTube every day from 7 to 7:30. But sitting on a cycle, and that cycle must continue till my program is over. So it has to be a stationary cycle. If you sit on a sofa and then watch my program, your diabetes will worsen. So sit on a stationary cycle, watch my program and cycle. Till my program is running, you are cycling. And that takes care of metabolic syndrome. पहले हम बोलते थे सास वो है घर घर की कहानी सुनो वो देखो, but अब हम बोलते हैं मेरा वीडियो देखो. So if you exercise half an hour every day, remember, cycling is better than exercising. Cycling is better than walking. Cycling and swimming are the two muscle strengthening exercises which can take away all disorders which we have spoken today, including COVID-19 severity.
Sir,
One last question.
which fruits are good for heart if anyone has blockage problem?
So if you have a blockage problem, bring your CRP to less than 1. Bring your LDL bad cholesterol to less than 50 if possible. Walk at least 500 meters in 6 minutes. To do that, 50% of your diet should be fruits and vegetables. And rest 50% you balance out your food. Do not take refined carbohydrates. Do not take trans fat at all. Do not take trans fat at all. I say there are two types of heart attack. One is called chini maida heart attack. That is because of you eat a lot of sugar, maida and rice. The second one is called ghee, tel, makhan heart attack. That means you take a lot of butter, oil and ghee. Depending upon what is your cause, we restrict them. Ghee, butter and oil should not be more than ½ kg per person per month. And take out chini, chawal, maida from your diet and take wheat out of your diet 80 days in a year. With that, you will become healthy. And the idea is that everybody has to die. You should die young in old age. That's the basic purpose.
Okay.
Thanks a lot, sir, for such a wonderful insight and your variable suggestions and all. I think everyone is so much overwhelmed and satisfied. I think they are going to practice the Monday to Saturday, and from Monday onwards, they are not going to say anything, any gossip and all. And even I am going to use this concept from Monday to Friday. And as tomorrow is Sunday, so my day starts with cheating day. So I take this privilege to start this cheating day. But from Monday onwards, I'll seriously, we take New Year resolution, but as this is not beginning of the new year, but yes, this is 2021 and
New week.
this is new week, and we are will, and especially I am going to practice this. Thank you, sir, so much, sir.
Thank you so
Thanks
much,
a
sir.
lot,
Thank
sir.
you so much, sir.
Thank
Thank you.
A small request to the participants.